It is Heart Healthy Month. Lifestyle changes and medicine can make a huge difference in improving your health. Welcome back, Dr. Venu Channamsetti. The last time we spoke, we talked about the most common types of heart disease, and today we're actually talking about treatments for them.
Yes, thank you for having me back. The first thing I want to emphasize is that although there are a lot of effective new procedural treatments, my goal as a cardiologist is to try to keep treatments non-invasive and as safe for the patient as possible. That's why, like you said, I really like to emphasize lifestyle changes like diet and exercise, and then make sure we've used all medications to make sure that's been tried. And then we move on to more procedural treatments.
Right, and because those lifestyle changes actually do make a huge difference.
Yes, exactly. So for example, we talked about coronary artery disease last time. So coronary artery disease, a quick review, is when you have blocked arteries in the arteries that supply your heart muscle. These can get blocked. And it's not just the severity of the blockage that could affect what the management will be, but it's also the significance. For example, let me ask you, if you had two patients with an 80% blockage in an artery, you would think that the risk is the same, right?
Exactly.
Right, but not necessarily. There's certain things in the blockages that make one far more dangerous than the other. By talking to the patient about their symptoms and doing some careful imaging studies, we could determine what the risk is. And so the treatment, yes, lifestyle changes for sure. We have great medications, blood thinning medications, cholesterol lowering medications, and medications that help actually dilate the arteries.
What about surgical treatment?
Yes, I was going to say, often this may not be enough. So if it's not enough, the next step is to do something called a cardiac catheterization. In this procedure, we go through the wrist or the leg and look for the actual blockage in the heart. What we can do usually is fix it with something called a stent. This keeps the artery open. Unfortunately, sometimes if the blockages are too extensive, we may need to recommend open heart surgery. I know this sounds scary, but in fact, it's actually fairly safe and very effective. What this is we take healthy vessels from other parts of the body, and we use these vessels to bypass the blocked arteries.
So it's actually the surgical treatment as open heart is actually becoming more common, isn't it?
It is becoming more common, but because we have these stents, we have a lot of options based on the patient's risk profile for invasive treatments.
Okay, let's go to heart arrhythmia.
Heart arrhythmias, like we talked about last time, the most common is AFib, atrial fibrillation. What that is an irregular and dangerous heart rhythm. First, we'll use medications to try to regulate the heart rhythm, but sometimes this may not work, or sometimes patients may have side effects to these medications. In these situations, we may consider something called an AFib ablation. What this is we go right through the leg into the heart, and we look for the faulty electrical signal that's causing the AFib. Then we can pass a small amount of radio frequency energy.
You blast it away, don't you?
Yeah, we basically blast it away with radio frequency energy, which again sounds scary, but it's actually, yes, but it's actually very safe. And what it does is it eliminates or at least significantly decreases the burden of AFib. Now, the other thing about AFib, we talked about this in our last conversation, is that these patients may be at risk of forming clots in their heart, and these clots can go on to form a stroke. That's why we need to put them on strong blood thinning medications, which is very effective. You may have heard of warfarin, and there's some newer medications too.
Those are the common medications we hear a lot.
But the problem is some people just can't take blood thinning medicines. They may already have bleeding issues. They may be at fall risk, and that would make that dangerous for them. So we have something known as a Watchman device. This is a device that we put right through the leg, and we implant it in the heart, and this will contain any clots and it will prevent strokes. And they don't even need to be on blood thinning.
So much information to share. I wish we can go on. We don't have a lot of time now, so thank you very much, Dr. Channamsetti. For more information, you can go to stvincents.org/heart.